Hey everyone, what's up? It's Dr. Charlie here. Wanted to shoot a quick video. Got a message from a man named Rory, super cool. You'll see him coming up here in a second, who's all shifted. So he's all crooked. He's had this problem before, but now he is shifted. As you'll see, he's kind of crooked to the right when he stands up at some point here in the video. He has what we call a lateral shift. All I knew before I met with him is that he had some leg pain and some back pain, and that he had tried some cobras and nerve glides that hadn't worked. In fact, as you'll learn, they actually made him worse. So I kind of walk through, I decode his problem. That's what we'll call it. I give him some tips. He saw another video of mine. He started the shift correction, which is basically just trying to, straighten himself out. I walk him through, hey, should he be doing that? Should he not be doing it? How much should he be doing it? I teach him this concept of using movement as medicine. And then I walk him through, kind of how to reconceptualize how he's looking at things, how to get the most benefit and bang for his buck out of using motion, finding what is most comfy for him, and a whole bunch of other cool things. I'm sure I could ramble for a while, but the point is check it out. If you are finding yourself in an acute episode of back pain with leg pain, definitely stay around, stay tuned, check this out as I walk step by step through with him some quick recommendations. Okay, so you got this butt pain, leg pain, or whatever, okay?
Yeah.
You're gonna stay as active as possible. That's the general rule of thumb, people with back pain. It doesn't mean push through symptoms and like kill yourself. It just means do as best as you can. Because we found that rest is worse than not rest, okay?
Yeah.
So stay as active as possible. If you like walking, walking is a yummy motion, we'll call it, a yummy activity, okay?
Yes.
Now, you like walking uphill better than going downhill, you just said, correct?
Yeah.
Cool. So you're going to walk and you're going to find a little uphill, and you can either walk level or walk up hills. And how many times are you walking a day?
I'm walking about maybe 3-4 times for 20 to 30 minutes.
Awesome, man. So you're going to keep doing it 3-4 times, 20 minutes. And here's what you're going to do. Instead of walking down the hill forward, how weird is it if you try to walk down the hill backwards or you try to sidestep down it?
Okay, that hadn't occurred, right? Okay.
So what I'm saying,
that hadn't occurred to me,
So what I'm saying is walking uphill is yummy, but then walking downhill kind of nicks the scab and makes it a little bit worse.
Yeah, a little,
Here's why.
Yeah.
When you have you just told me some really telling things. I'll just decode this for you fast, okay? So here's what you told me. Hold on a second. I'll put it over here as a new little thing. Yeah, it's fine, man. Do what you got to do. So you just told me I tried cobras, right? Mckenzie press-ups or whatever. I tried nerve gliding, and it was no good.
Yeah.
No bueno.
No bueno.
Okay? So no bueno. All right. So now, what that tells me, the cobra is this position. Okay, it puts you in this position lying down. Oops, shoot, sorry. Put you in this position lying down like that. Okay. Right. And there's your hand, and there will be whatever. Okay. Now, when you're walking downhill, here's a hill. There's a hill. Okay. When you're walking downhill, you have to be more vertical and leaning back almost a little bit, because if you lean forward, you will fall down the hill.
Correct.
Or you will make it not mechanically efficient. Fair?
Yes.
So your leg is up here going down. You can see the similarity, right? That this is a curve into the back bend direction. This is a curve. That's why you can't walk downhill comfy.
Yeah, okay, cool.
So you like walking uphill because it puts you into a little bit more of a shifted, your yummy right now is a little bit forward and whatever. All right?
Yeah, exactly. Yeah.
So that's why you like walking uphill. So use the yumminess to your advantage. So what you're going to do is you're going to walk, and you're going to walk uphill versus straights 3 to 4 times, follow comfort and yumminess. And then when you walk downhill, don't nick the scab by putting her in that position. Walk backwards down the hill, back step, be safe. Okay?
Yeah.
Back step down.
No.
Or test walking sideways. So here's what I mean by that. Right now you're standing and you're shifted to the right, meaning you're looking at me, okay? And you are like this. Here's your shoulders, and here's your hips, and there's your legs. Okay? So you like, right now, if I told you to put your body to the left, you may or may not like that. So you have to decide okay, what feels best, but this is your natural position your body wants to go into.
Yeah.
So let it do that. So how would you do that? What would you do is you would like choose to walk potentially sideways down the hill. So if I had, right, if I was walking sideways down the hill, then my body, if I go down to the right, is probably going to want to bend a little bit to the left on the upside of the hill.
Okay.
If I go down, if I flipped around and went the other way, and there was a hill here like this, then I would probably be tilted to the right, like you are right now going down it.
Right. Okay.
Your body would probably like leading with the left leg down the hill more. So that's how I would sidestep down the hill. And then what would I do? I'd walk back up the hill. And then I'd sidestep a little bit and I'd walk back up the hill. So you're always doing yummy.
Okay, cool. Yeah. That makes, that makes sense.
So I know it's weird, but you're going to have to do some weird stuff if you want weird response.
Yeah, cool. Yeah. No, that hadn't occurred to me. Yeah, but that makes total sense. Yeah.
Yeah.
And well, I'll carry on with these shift corrections because they've definitely got most of the pain out of the leg, you know, and most of it back up to the center of the back, sort of thing.
And you want to think of it like this, okay? So you want to think of the shift correction or whatever motion as a pill, okay? So you've got a pill here, right? And we'll call that your that's your shift correction, okay? So your shift, okay? Shift correct.
Yeah.
All right. Now what you want to do is you want to pop that at small doses. Small doses. And you want to pop
Don't make me laugh.
Sorry, man. And you want to, I didn't mean that on purpose. I just
I'm joking.
And you want to pop that pill, movement pill, every couple of hours, right? Or whenever you feel you need it to keep symptoms at bay. But you don't need to do hundreds of reps. You just need to do maybe 5 or 10 just to say, if this helps me, I'm gonna snack on it every once in a while.
Yeah, okay, yeah.
Got it?
Yeah,
and
totally.
Then obviously you're paying attention to not doing things, right, which make you feel yucky. Avoid this. Avoid the nerve gliding because your nerve is going to be hot and bothered. So you're trying to simmer it down by shifting triggers throughout the day, okay? Meaning putting yourself in yummier positions, right? And then doing more, which makes you feel better. The little shifts, the walking uphill, but not nicking it when you come downhill, whatever. So then you can create an optimal healing environment and then tip the scale and you can feel better.
Yeah, that's so cool. Yeah.
Cool.
Yeah, that's so cool.
Cool.
Yeah.
All right. Is that helpful?
And just absolutely, totally. You know, hopefully we hook up in a while, you know, sort you out. But one thing is the mornings are pretty. I sleep in a kind of on my good side, in a fetal position, and in the mornings, I wake up 2-3 times in the night anyway at the moment, which is better than was like last week when I wasn't getting really much sleep at all. Mm-hmm. Is there an optimum sort of sleeping position, do you reckon, for or to just have to? I mean, after about half an hour, I can get myself sorted out and get the motion going, and then I'm okay to start my walks, you know. Mm-hmm. But should I just stick with that from the sleeping perspective?
Let me see. Hold on a second. So this is my secret sauce. Okay, so I'll share a little bit with you. Okay, so. Right? This is where, in the presence of a yucky environment, your chances of healing are not good. All the yummy feel-good treatments of the world won't overcome an environment that's not optimal for recovery. Yucky environment, pain, healing. Most people think that to solve this problem, I just do this exercise and it's going to solve everything. And that's it's trying to add goodness. But if you're doing yucky stuff, you're going to really struggle. I'm not saying it can't work. Yeah. I'm just saying it's going to be tough. Okay. Yeah. So then the big picture is that we can shift pain triggers, right, by teaching you better ways to do things. If sleeping is a pain trigger, we need to tweak and fix this first because poor sleep equals more pain, okay?
Yeah.
So here is what I would change first, okay? Nighttime routine. What are you doing right before you go to bed? Ask yourself, are you doing something that's yummy, whether that be being inactive or active? Like, what does that look like?
Yeah.
So I don't care what it looks like.
Yeah. I suppose I sort of don't do. I should probably do a little sort of walk before I crash.
I would do a walk right before you go to bed if you can.
Yeah. Okay. Yeah.
Within the
And I've
hour.
tried to, yeah, okay, yeah. And what about like, is having a hot shower and stuff, is that good or bad or?
It's not good or bad. You just have to test it. If it makes you feel good, it adds to the yummy side, do it.
Okay, okay, cool, yeah.
All right, so yeah, so test. I would say you've got a motion that you can do before bed that makes you feel yummy, such as walking up a hill or something like that, then do it within the hour of going to bed. And then, by the way, when you're inactive, or if you're doing something a little bit inactive right now, do not do this. This motion right now, you're telling me is painful.
The sort of fetal side. Just. I mean, it's okay. Like when I'm falling asleep, but when I'm waking up, it's sort of.
These nerve glides are painful.
They are, yeah.
Yeah, because you don't have your ability to straighten your left leg. I guarantee it.
Correct.
Or maybe even your right leg. Okay, because you have sciatica from a disc problem. All right. So point is that this leg raise, this is how it looks like in life. You can't be doing these things.
Okay.
You can't be running. You can't be sleeping with your leg funky. You can't be picking. You got to be careful. You can't be sitting like this watching TV or reading a book.
Right. Yeah. Okay.
You understand?
Yes. No, I get you. Yeah.
Okay. So don't be reinforcing this yucky motion. All right.
How did you know I couldn't straighten out my good leg 100%?
because you have a shift, which means I pretty much guaranteed you have a disc herniation, a far lateral, we call it, out to the side disc herniation. It can get better on its own, so don't worry about that. But in most cases, folks like you will have what we call a crossed straight leg raise, which means not only is it painful to straighten the side where most symptoms are on the left side in your case, but you're not able to straighten the other side as well. That is a very specific test for a disc herniation.
Okay.
So you've got a cross straight leg raise and a same sided straight leg raise and a shift.
Okay.
So if you come all the way up, okay, and we go to sitting, right? You're going to want to say, first things first, can I do something yummy before I go to bed and change my nighttime routine? That is number one that I have people change. Why? Because control the controllable. When you're awake, you can control things better than when you are asleep.
Sure.
Test a hard versus soft surface. My guess is you're probably going to like something more firm, but I'm not always right.
Yeah, okay.
So do that. And then position. There's a lot of different positions that you can try, okay? Right now, if a knee to chest position is a little bit yucky or going in that position, then you sleeping in a fetal position is probably not the best, right? So maybe you try side sleeping and you try some small pillow or towel or something like that underneath one of your sides to keep you in the most comfortable side bent position. Remember, your body wants to bend to the right. So it might like this, bending to the right and lying.
Right. So lying on my right side lying on the good side with the pillow over so it pushes the spine to the left.
It might like that. You might say, your theory, Charlie, is not, I don't care. I'm not about being right or wrong. I'm just saying, you test this then. Lay on the side, and this would put you in a shift corrected position, sort of. Side to the left.
Yeah, okay.
This would be like you doing a shift correction while you're sleeping, but it might not be able to tolerate it.
Yeah, okay, yeah.
Okay, everyone knows the pillow between the knee trick, or if you don't, do it. Okay.
Yeah, I've tried that one,
And you can try it. So the cool thing is you're not doing brain surgery here. Just try it for 5-10 minutes. See, do I like this one? Do I like this one? Do I like this one? Okay, cool. No, I don't like any of those. No problem. If you want to lay on your back, try a pillow underneath the knees. Sometimes it helps slacken or shorten the nerve. Okay, next. Okay. Maybe I roll up a towel or something. You know, I take an old bed sheet. I wring it out. I roll it up or whatever, twist it, and then put it around my waist, and I tie it around my waist so that I have something that gives me some type of support behind my back as I sleep. Okay, well, that's different.
That helps with driving a little bit, to be honest.
Yeah, cool, man. So pillow under the pelvis, frog leg, the dangle, whatever you want to call it. Okay. All right. So those are the things that when I instruct people in sleeping, in some of my programs, right, that I help people with this through my treatment programs and protocols, this would be something that I would give to them or whatever, but I'm just showing you so you can start to implement some of these things.
Okay, cool.
Got it?
Yep.
And that's it, man. If you keep going, you should do pretty well.